South Carolinians receiving government health benefits right now could soon be required to work to keep receiving that coverage.
Governor McMaster tells us that South Carolina is looking to impose a work requirement for adult Medicaid recipients once President-elect Donald Trump is back in office.
State House reporter Mary Green has more on this proposal.
During the first Trump administration, South Carolina had been approved to enforce work requirements for Medicaid recipients, but they never went into effect because of the COVID-19 pandemic. And the Biden administration has not allowed states to impose these mandates. South Carolina will soon ask for them to be reinstated.
They have to do something other than just stay home or do nothing. That is a very simple requirement. We think it is essential.
Governor Henry McMaster has already directed the South Carolina Department of Health and Human Services to be ready to submit a request as soon as Donald Trump is inaugurated to enforce a Medicaid work requirement in the state.
If you have able-bodied adults, able-bodied, they ought to be working if they're going to receive benefits from the taxes of everybody else.
If South Carolina's waiver is approved, this requirement would apply to adults ages 19 to 64 who are not disabled, about 200,000 people right now. It would require them to work at least 80 hours a month or log that same amount of time in job training, taking classes, or volunteering to keep receiving these benefits.
I always am concerned when we're adding requirements onto programs. I mean, healthcare is not about work. People need health care.
SC Appleseed Legal Justice Center, which advocates for lower income South Carolinians, says many Medicaid recipients who can work likely already are or are trying to find a job. But they fear some could lose their coverage because of administrative burdens or barriers like not having transportation to work.
Or when we're at a lower unemployment rate, there may not be jobs available for the people who actually are looking for the work. And what we want to do is make sure that we're not making it punitive, that we're really helping people succeed in work.
Under South Carolina's previously approved waiver, this requirement would not have applied to people living in a region where unemployment is 8% or higher, or when that statewide rate is that high. That was one of around a dozen exemptions under the former request, with the exemptions that will be submitted in this new request still under review.